Hello, I'm Simon Galczynski and I'm the Service Director for Adult Social Care for the London Borough of Islington, and I'm the other co-chair for Islington's Making It Real board.
Excellent. Now, the schedule has taken a little bit longer because we all enjoyed the dinner so much. It was lovely, wasn't it? But I was wondering, when I came here, I acquired an injury 9 years ago, and if I'm being honest, as much as I hope to be the sort of person who would like to think that he would support people with all abilities and diversities, I often think when I work with NHS England, the National Co-Production Advisory Group, doing talks to social services in the NHS, how often do we actually put ourselves in the position of the people that we're there to support? Now, I have what's technically known as a level C4, C5 spinal cord injury, which effectively means that I'm paralysed from the neck down. So in order for you to put yourself, not in my shoes, but in my wheels, would you like to play a game with me? Would you like to play a game with me? Yes. Thank you very much. I'd like you all to stand up, please. Now, I realise that this isn't the most inclusive game, Janet, but for those who can stand up, for those who can, I'd like you to put your hands in the air. I'd now like you to wave your hands in the air. Now, there's absolutely no reason for me to do this. I just think it's funny. If you'd now like to put those hands behind your bottoms, please, and sit on your hands. I'd now like you to cross your legs. Okay, so we can't use our arms and legs. I now want everyone, and I'm going to keep my eyes open to close their eyes. And I want you to imagine, eyes closed everyone please, I want you to imagine that this is your life for the next 6 years. What's changed? What's different? I'd now like you to open your eyes for a short time. Hands up. What were you thinking about? Were you thinking about the things that you can do or the things that you can't do? Hands up, anybody. Things you can't do. Isn't it amazing when faced with a tough challenge, such as implementing personalisation and making it real, that sometimes we focus on the things that we can't do? Now, I wasn't actually describing my disability. I just told you what my disability was. What I was describing there was how, without a personal budget, without personalisation and control, that it was actually the system and the environment around me that was giving me that disability. And with a personal health budget, things changed hugely. The project Making It Real, some people will say these projects have the cynics, but we're about to see from Sandy and Simon in Islington of how fantastic, how these practical elements, and we actually can do things. If we stay positive and work together, we can make a positive difference. Okay. So it's okay.
Yeah. So I'd like to ask you the first question: is how did Making It Real start in Islington?
Maybe we. The way it started really was we had something called the Islington Personal Budgets Network on one hand, and the council on the other hand, wanting to work collectively with services to actually design something called Making It Real, which I didn't know anything about. But one of the things that we agreed in the beginning was that, I've lost my notes, so I now can't remember, that there would be co-chairs, that we would work together using the SKY's co-production method, that we would have experts by experience, service users, carers, whatever, on the board as full members, with support, with training, and that they would be paid for the assets that they brought to the organisation. So that's before it started, and then since then Simon and I have worked together.
And maybe if I can just, I guess from a personal perspective, even before that, so when I first came to Islington, Islington was doing really well in terms of the number of personal budgets, so that indicator when we were talking about numbers earlier on. But actually, when I started to talk to people that were using personal budgets, the experience was very varied. And Sandy was heading up a group called the Islington Personal Budgets Users Network. And everybody said, oh, when you go to see them, they're going to give you a really hard time. So I thought, okay, this will be fun. Went along, had some discussions, and people told me about the challenges that they were having. And I also went out with some of our social workers, and I realised actually a lot of our the way we were approaching direct payments, personal budgets, a lot of it was becoming really process driven. And I think the one of the real moments for me was going out with a social worker who was on a visit, not dating, who was a fantastic social worker, but she went out with a stack of forms to fill in around a personal budget. We were meeting with the service user, and the person was telling us about she was finding it really difficult to keep maintaining a relationship with her daughter, and what she really wanted to do was have some time to spend with her daughter to go out and do things. And the social worker said, that's all very well, but we haven't got much time, we'll talk about that next time, we need to fill in the forms about your sport plan. That person's actually telling you what they want. So it was about, with all of those different views and actually getting caught up in the process, how do we find that space together where we can actually meaningfully work on actually getting, actually making it real. And I think the Making It Real programme gave us that opportunity, and then putting in place those principles that Sandy described was really important.
Can I ask you, how did you find the right people to work with?
We advertised for people. We asked voluntary organisations. We didn't choose people we knew. No. We chose people who would be interested. So we asked some voluntary organisations if they knew people. We asked the carers group if they knew people. What we were looking for was not the usual suspects. Although the usual suspects are lovely, and I'm sure there's lots in the room, you actually need to kind of expand out and develop.
So we talk a lot about co-production, and it's kind of the buzzword, but actually affecting true co-production is a difficult task, and getting the right people in the room is the first challenge. What other tips would you have for people out there to truly develop and embed co-production?
So, I think, on one of these slides, got our, which you can't see from there, sorry. So, we've got what we think are our top tips. So, one of the things was about actually spending time talking to our key stakeholders. And what was really important, I think, was to give people that were involved in co-production some time and some training, particularly around being leaders in their own right. So a lot of time invested in community leadership programs, those sorts of things. And one of the things we did as well was we established a co-production concordat, which we're happy to share, and we got everybody involved in the Making It Real process to sign up to that, which is about the key principles, how we were going to work, and actually get sign up from all of our organisations, both corporately as well as within the Making It Real board.
Sorry, did you?
Do I want to add anything? No, we just sort of, we use Sky, and then we use the co-production concordat to make it really clear about where were the areas that we could make decisions. For example, we cannot decide in Making It Real how much budget we're going to get from central government. We cannot decide how much of the budget that comes from central government is coming into adult social care. That's outside of what we're doing. So we're making it clear what we can decide and what we can't decide, which is a much more honest way of working.
Exactly. Focusing basically on the things that you can change rather than the things that you simply can't change.
Yeah.
You didn't go for the big bang approach. Sometimes when we face with these schemes and the big challenge, from what I gather, the process involves splitting things up a little bit. Can you tell us a little bit about that?
We've been going for a year, and we've looked at the TLAP stuff and the I statements, and we're taking a few at a time, and we kind of developed the I statements in small working groups, and those small working groups include experts by experience and council officers and maybe health people or whatever, and so that actually each of the elements are co-produced. And if you press that again, we've got something called a wall of achievement. It doesn't work terribly well up here, but it's all the I statements, and then there are ticks when we've completed it, and that comes through each Making It Real meeting. And if anybody wants to challenge a tick, they can, and actually ask us to look again if they don't think we're actually meeting it. But we're doing it we haven't got everything in place. And if we had everything in place, it would be wrong. So we're doing it together.
Can I ask you, Sandy, what have you achieved so far in Islington?
God, do you know, I think the biggest thing that we've achieved is the culture change. There's the acceptance right throughout the organisation that actually working with people rather than doing to people, and actually acknowledging things are beginning to change. It's really difficult to sort of say we've done this. I mean, something which Simon raised yesterday at our Making Real board was we've got a new PA finder system. Now the officers brought a £20,000 proposal to the small working group, and experts by experience says that's very nice, but we don't need to spend £20,000. What we need is something simple, easy, which allows direct payment users to find people, and that people who want to work have got a place where they can advertise. Maybe in a year's time that doesn't work because there's more demand, but for the time being we'd rather spend 20 grand on more support for people rather than spending it on some whiz-bang thing that some consultant has worked out. And there are lots of other smaller things that are really about changing, attitudinal change.
Attitudes, exactly. That's a big thing, and how people perceive people living around support and disability and diversity in general. I remember from a conversation we had, Simon, that we talked about some of the things in terms of market shaping, looking to get the market ready in PAs and people in re-employment. Could you tell us a little bit more about how Making It Real's affected that in Islington?
So, I mean, going back to what Sandy was just saying about the PA finder, so we were going to take quite a traditional, well, I would say quite a traditional approach to commissioning something that that effectively people could then sign up to if they're interested in becoming PAs. And actually, by working together with people that use services, we've managed to shape something that we can now use to advertise for local people coming into employment. And also, if people have got PAs who have got some additional capacity and time and they can recommend, they can also use the functionality within this PA finder for that as well.
Fantastic.
And what do you think you've learned along the way?
I'll start and say I think it's fine. It's fine to make mistakes, and there's something about risk taking. So one of the we said about the time it's taken to really get this to the point where we are genuinely co-producing. And initially, I had to convince, for example, our lead member that this is the right thing to do because she was saying there seemed to be an awful lot of officers in the room. Spending a lot of time on this, and I said, "Trust me, you know, go with it. This will work. We need to do this. We need to spend the time doing this."
Do you think that's important, Simon? Do you think the leadership element's important?
It's really important. So by the time we came to our Making It Real board yesterday, it was the experts by experience who were doing most of the talking and leading the board. So it became far less officer-led, far more user-led, because the people had the skills, experience, and confidence to do that and to be feeding back on the progress we were making. So for me, experimenting, trying new ways of doing things to get to that point was really important. Getting the buy-in and trust from senior leaders to support that process.
Sorry, from my side, I think that the leadership programme that was developed to support experts by experience was really key, and they're all down there. Hello, you lot. Because we've come mob-handed, and that's the way that we do things. We don't have, we don't just have an officer turn up, we don't just have an expert by experience, we actually come together, and I do think between us we're sort of more than the bits.
I know we are short of time in terms of the agenda, and there's lots and lots of questions that I'm sure we'd all love to ask you. I know that you're open and receptive to sharing information. I think part of not reinventing the wheel, and when we've had success and learning from others, is part of it. But if you could say to people in the audience that are looking to implement this scheme, what tips would you give? 1 or 2 tips each, perhaps. The key things that you'd say, these are the things that we'd say that you could are transferable to aid and assist you in your local areas implementing
I
it.
would say to officers, trust service users, to be able to go beyond the I need this to we need this. And I guess for service users, you know, there are some officers out there that will work with you and walk the walk.
I would say make sure that you invest time and resources, because you have to do that to get this right. And I think agree a really clear framework for how you're going to work together, and be very clear about those areas that you're going to work together on, and be very clear about how you're going to demonstrate progress on that.
Fantastic. Okay. Can we have a round of applause for our guest here? I know that we had on the agenda to perhaps ask questions. Do we still have time to 5 minutes for questions at all? Yeah, is that okay? Would anyone like to ask the panel any questions? Raise a hand, I'll give you a nod.
Don't be scared. No?
Fantastic. There you are. Well, I felt a little bit like Philip Schofield with a hair dye here doing this today, and Amanda Alden. But look, thank you for your time. It's been extremely interesting, and I hope as an audience you've got something out of that. All the best of luck in terms of the delivery scheme.
If you want to come down, and we do have visitors that are making it real board, one at a time. But if you want to come down and talk to us, we're really happy.
Yeah.
Fantastic. Thank you very much for your time. Thank you. Cheers. Just for... She was pointing at that note then, by the way, ladies and gentlemen. There have been 1 or 2 changes to the schedule. Information and advice, I'm not sure where it was before, but it's now going to be in the Butterfly, the Papillon suite, I believe. So that's a Papillon suite for information and advice for those that were attending that workshop. The Building Community Capacity Workshop is going to be in the lower saddle bar. That's the lower saddle bar. If that's not clear to anyone, if you come to the front of the stage, you've got people here who can help guide you around. Enjoy the rest of your sessions in the afternoon. Thank you for your time.